It's the developing world that has been hardest hit by the AIDS epidemic. 90% of the people infected with HIV live in developing countries. Most don't have access to the drugs that could keep them alive. The cost is way beyond their reach. In the West, the introduction of drugs that inhibit the AIDS virus, antiretroviral drugs, has radically changed the outlook. Hospices and hospital wards have closed. HIV remains ultimately fatal, but is now a chronic disease that can be treated. Most antiretroviral drugs are still under patent to the multinational companies, who make huge profits in the West from them. But for AIDS sufferers in developing countries, their cost is a death sentence.
This is the worst, probably, epidemic mankind has ever faced. If we really want to tackle it, as we have been able, or we are busy to do in the north, here in the south, we have to make those treatments available.
An educational campaign has helped slow the spread of AIDS in Thailand, but they still have 1 million HIV-positive people. Thailand and South Africa are two of the countries that can't afford drugs for their HIV patients. Both are now campaigning for the right to essential drugs at affordable prices. Brahmo is 29 and has AIDS. If he'd been able to afford antiretrovirals, he would not be paralyzed and bedridden today. But Brahmo is one of the luckier ones. With the help of a project, his family is able to care for him at home, a great improvement on the treatment afforded most HIV and AIDS patients. The home care nurse and doctor visit regularly, giving support to his family and supervising the treatment of the kind of infections that attack HIV and AIDS patients.
There's a lot of things that you can do, and you can treat all these opportunistic infections, and people can live longer and have a better quality of life.
Without this help, the family couldn't cope. I don't want others to be like me. I sometimes suffer, but I don't feel hopeless. I worry about my sister and her children, that they learn to be safe. Antiretroviral drugs are not an option for poor families like Brahmo's.
If we would have been able to start antiretroviral medicines earlier on, he wouldn't be in the situation as he is now.
In 1977, the World Health Organization realized that the world was not getting a good deal. And they made this model essential drug list, which is basically an example for countries to actually do it themselves.
Essential drugs are defined as those that meet the health needs of the majority of a population, the drugs that are essential for life. It's vital that these be cheap, safe, and efficient. Generic versions of most drugs on the World Health Organization's essential drugs list can be produced cheaply because they're no longer under patent.
Antiretrovirals are essential drugs, although they're not on the essential drugs list yet. And that's where the problem starts.
They are not included because of high costs. The only antiretroviral drug currently on the essential drugs list is AZT, and that only to prevent mother-to-child transmission of HIV.
The problem is we do not really know what the real cost of those antiretrovirals is. We do know, however, that in certain countries where at the moment they don't have to abide by those patents, that the antiretroviral drugs can be made much cheaper.
Pharmaceutical companies remain reluctant to provide information on the cost of producing specific drugs.
How much does it cost to manufacture these drugs, do you know?
Pass. I'm sorry again, because we may not be able to talk directly to that.
There is no requirement for any company to divulge their costs. It is not part of the system.
In the southern African region, it's estimated that 22 million people are HIV positive. In South Africa alone, 4.2 million are affected by HIV. Last year, more than 100,000 South Africans died of AIDS-related diseases. Sister Abigail is a community nurse in KwaZulu-Natal. She has a large family of adopted children who fill every corner of her house.
I've got 14 children. 3 of them are orphans from the AIDS epidemic, which is affecting our country. Both mother and father are dead.
She makes sure that no part of their upbringing is neglected.
Food and friends for love and hugs, thank you, Lord.
Underberg, the town where Sister Abigail runs the government health clinic, serves a large rural population. Patients from outlying areas travel long distances to the clinic.
High school.
Her community has already been severely affected by the AIDS epidemic.
When I take 10 bloods, 6 come back being positive. But it's not a full picture because it's not everybody who comes up for testing. The impact of HIV and AIDS has really put a heavy load on me because it's not only during the working hours that I'm dealing with these problems.
She's taken on the responsibility of trying to care for orphan families in the district.
I've got many families like this. This family is typical of what we see across the country due to this disease. It's really affected. There are 3 members of the family that died. They were also breadwinners, 2 sons and 1 daughter. And all the orphans that are here are 7. And they're being looked after by an old lady who's on pension. So they're old people who look after these young children. And for how long are they going to look after them? Are they going to be able to educate them, to give them the mother love or the father love that they're supposed to get, nurture them in such a way that they're groomed for the future? We've lost a high number of teachers, nurses, school children, farm workers, even miners. They come back from Johannesburg as corpses or just about to die. I think it would be much easier if we can get the retroviral drugs free of charge. Because when I weigh the expenses of looking after orphans with no breadwinner and then getting the drug, I think getting the drug it will make a big difference.
Until recently, Sister Abigail's small town had no undertakers. Now it has 4.
To treat one patient for a year with antiretrovirals using what we call the triple treatment or the cocktail, 3 drugs, which we consider scientifically the best, was costing us more than 70,000 rand per year, or 7,000 pounds. We have 4 million people who are infected. So if we would treat all 4 million, the South African government would have to fork out 28 billion pounds.
28 billion pounds would be 10 times the total cost of South Africa's annual health budget. In 1997, South Africa tried to pass a law which would allow it to produce generic drugs and so have treatments at affordable prices. They relied on compulsory licenses and parallel importing, practices which had been agreed under World Trade Organization guidelines.
What happened was that South Africa developed a very good national drugs policy, which said that there should be equitable access to all essential medicines for all South Africans.
The pharmaceutical companies condemned this as piracy. They said it would violate patents and so undermine their profits. They intervened directly and sued. South Africa was threatened with trade sanctions. The trade-related aspects of intellectual property rights, the TRIPS agreement as it's known, allows member countries of the World Trade Organization access to cheaper drugs. Article 31 of TRIPS says that in a national emergency or other circumstances of extreme urgency, a member country can use a compulsory license to manufacture generic drugs and may import medicines more cheaply from other countries.
Because when you produce drug without patent, generic drug without patent, it will be maybe 200 times cheaper.
In 1998, Thailand attempted to use the TRIPS agreement to manufacture cheap generic antiretrovirals. The United States threatened to block Thai exports to America.
The US government is the main customer, so to say, for Thailand. A lot of export goes to the United States. So trade sanctions would hurt the Thai economy very seriously.
It's economically very important for the US to actually protect this big industry that they have. It's a very profitable industry. It produces a lot of taxes.
Of course, we're always talking about the US government. We should not forget to say that the European Union is not any better at all.
Most major multinationals are satisfied with annual profits of 4 to 5%, but the pharmaceutical giants regularly record annual profits of around 22%. Only 1% of their turnover comes from sales of drugs to Africa. They do make contributions to community-based projects in developing countries. They also make large annual donations to the American political parties. Some people suggest this means they exert undue influence on governments.
Not only pharmaceutical industry, all the multinational industry, they are controlling the life of the people in the world. They are controlling the government. They are controlling international finance organization. They are controlling banks, everything.
Activists around the world have been waging campaigns to try and get access to cheaper drugs. They feel that the prices set by the drugs companies are not justifiable. The Thai activists are campaigning for their government to be allowed to produce a generic version of the drug DDI, marketed as DIVIR in Thailand. Bristol-Myers Squibb keep the price of DDI high. The National Institute of Health in the US developed this drug and handed the marketing rights to them.
DDI campaign, that is the first action we have, demonstration. That is the first time for people with HIV and AIDS come together and to sit in front of the Ministry of Public Health.
They got a lot of attention from the press, and it was good, and especially from international press as well.
That is difficult for us, but we have to do. DDI is so expensive in Thailand.
Bristol-Myers Squibb has said repeatedly that, why do we fight for DDI? Is this available? Well, yes, it's available if you can afford it.
Bristol-Myers Squibb were unable to provide anyone in Thailand who could comment.
Actually, I have a problem doing research on antiretroviral drugs. So it is very, very difficult for me to find the raw materials. I sometimes was blocked by drug manufacturers from getting access to the raw materials.
In May 2000, President Clinton issued an executive order stating that the United States would no longer try to block countries using the TRIPS agreement so as to make cheaper drugs for AIDS treatment accessible and affordable.
The United States will henceforward implement its healthcare and trade policies in a manner that ensures that people in the poorest countries won't have to go without medicine they so desperately need. I hope this will help South Africa and many other countries that we are committed to support in this regard.
Clinton basically confirmed what the South African government has been saying all along. That is that South Africa and also all other developing countries have a right to actually use compulsory licensing, because that is agreed to in TRIPS.
Some health experts argue that it's too complicated for patients in developing countries to use antiretrovirals. Pharmaceutical companies have given this as a reason for not making the drugs available.
Here in Thailand, we work very closely together with people living with HIV and trying to improve access to treatment and care.
Thanapon is 6 years old. He was born HIV positive. When his mother died 2 years ago, he went to live with his grandmother. He receives antiretroviral drugs as part of a home care project. Since he's been on the drugs, his health is good and he will soon start school.
It's her decision, I think, what she thinks is best. In the evening, yes, that's outdoors.
Living conditions here are not easy, but as we can see with this boy, it doesn't mean that he's not able to take medicines regularly.
One of the mistakes also in this discussion is always to talk about either nobody has the drugs or 100% of people with HIV should have the drugs. I think we have to start somewhere in the middle, because if some of these drugs will become cheaper available, many people will start to be able to afford those drugs. If by next year 30% of people with HIV can have the drugs, maybe in 5 years it's 100%, I don't know.
In South Africa's rural areas, access to basic health care is often limited to mobile clinics. Not all developing countries have the infrastructure to administer antiretrovirals, but health workers in several countries are confident that they could handle the associated problems.
I think that that will be dealt with easily, because the people already are on multi-dose therapy for TB, which they are managing with soil. And we can even use the traditional healers, the shop owners, the ministers, and relatives.
This country, South Africa, is used by the pharmaceutical company to test all the new drugs. So if they can test the new drugs, why wouldn't they be able to administer the old antiretrovirals?
The World Health Organization and the UNAIDS have constantly been pressing drug companies to lower the prices, and they've said the developing countries especially should actually pay less because they can afford less.
While we were making this film, the pharmaceutical companies announced a reduction in the price of antiretrovirals. But the move was received with caution.
Even if it was a 75% price reduction, it would still be impossible for the South African government to actually afford all these antiretrovirals, even at the lower prices.
And the realities of the situation is that from our preliminary calculations, we will not be able to afford it.
In Thailand and many other countries, AZT is routinely given to prevent mother-to-child transmission. It's cost-effective too. Looking after a child born with AIDS for 5 years costs almost 20 times more than the cost of treating the mother with AZT in pregnancy. Treating mothers with AZT isn't yet national policy in South Africa, although there are pilot projects like this one in Khayelitsha, a large township near Cape Town. The project was started in a government primary health care clinic in partnership with Médecins Sans Frontières.
The project of Médecins Sans Frontières in South Africa is twofold. First, action for treatment people living with HIV, an MTCT program, prevention of transmission from mother to child, HIV. So that's one fold. The other one is political action, lobby to push the government and pharmaceutical company to make cheaper drug available in the country for HIV-related diseases.
In this community, it's estimated nearly 1 in 4 people is HIV positive. Developing countries know that drugs are only part of the answer to the AIDS epidemic. Education and changes in behavior are essential to prevent the spread of the disease.
I think they really want education about HIV/AIDS. That's where we can conquer it.
Nomfundo Dubula is one of the women in the Khayelitsha project. She learned she was HIV positive when she took a voluntary antenatal test.
It was very difficult for me for first 2 days or more. But I just accepted that I'm positive, and then nothing happened. Like, I was normal as before.
The great news is that people here accept to go for testing. 75% accepted the test, when a test for them is something terrible. And to those mothers, we tell, afterwards, we will not drop you, we'll give you a bit of follow-up, treat you opportunistic infection, and hopefully, at the end of the day, treat you with antiretrovirals.
I was pleased, very much pleased, because since I was counseled and told that my child can be negative if I use the AZT, I preferred to because I wanted the child.
This country produces 65,000 newborn HIV positive per year, each year. So at least let's start with preventing a transmission from positive mother to their child. Because if you don't do anything, the transmission rate is about 30%. If you do something, the transmission rate for the moment with AZT can be dropped to about 10%. And we have to make it like they managed to do in Uganda, where to be positive becomes more or less something normal, acceptable, I would say.
And this is account.
Bringing hope helps the people to enter in a way the reality of AIDS.
Drugs are not the only solution to the AIDS epidemic, but having them prolongs life and makes people more aware of the disease and so more open to education.
Everybody is human being, so everybody should get access to the drug, wherever they are, whatever stage that they are. So I feel that this is not right to say that for poor people or for people who are illiterate cannot get access to the drug. That's not right.
If you give somebody hope, they live day by day for a day.
With affordable drugs, people with HIV and AIDS could remain healthy and live longer, more productive lives. Antiretrovirals are essential drugs. By reducing their profit margins and allowing poorer countries to manufacture generic versions of them, pharmaceutical companies could make a real contribution to containing this devastating epidemic.